Hi, welcome and thank you for joining us today. I'm Nick Yap, your caring pharmacist and host for today. We want to talk about kidney and diabetes today because we know everyone went all out eating during the Raya holidays. We are truly Satu Malaysia, Keluarga Malaysia when it comes to Raya holiday. Muslims eat, non-Muslims also eat, and worst of all, Muslims puasa then eat, the non-Muslims don't puasa also they eat. So this is the reason for all Malaysians and everyone to be very cautious of diabetes and also their kidney issues. So if you have concerns about your sugar levels, lepas makan baru risau. So tak payah risau, jangan risau. Our guest today is Associate Professor and Consultant Nephrologist from University Malaya, who has extensive research and working experience in this field. Also, we will be having a surprise giveaway for 6 lucky winners during this session. So you still have time to call up your friends and family to join this live stream now. Without further ado, let us welcome our guest for today, Dr. Wan Ahmad Hafiz. Hi,
Evening,
Doctor.
Nick. Hello, Nick. How are you?
Good. So it's really a pleasure to be seeing you here today because
Thank
of
you.
it's after Raya, right? After Raya, everyone ate a lot. So, but before starting, we want to talk about your role. So, Doctor, just now I introduced you as a consultant nephrologist. So, do you see a spike in diabetes or kidney problems after Raya? They say, oh no, lepas Raya COVID will naik. So, lepas Raya masalah gula ada naik tak?
Yeah, certainly, Nick. Because I think during Raya time, and this happens all over the world during Christmas time, people tend to kind of, it's Raya time, so I don't want to go to the hospital yet. Let me kind of enjoy my Raya first. And then only after Raya, they go to the hospital with all sorts of complication. So yes,
Yeah,
we
so a
do. We
lot.
do see the spike, yeah.
And a lot also like never mind the Raya, right? I eat first, I will take care later. Right? Raya is the no is the no, out of
True, yeah,
out of
true.
the jail
2 years
free
cannot
card.
Raya, Nick. So this is the time they want to
Yeah.
enjoy Raya.
So
So
eat first, risau bimbang nanti. So I think a lot of audiences they are still a bit confused on what a consultant nephrologist like you do. Many patients go like, saya ada masalah kencing nak jumpa nephrologist ke urologist, apakah beza dia? So do you mind sharing with us a bit on your day-to-day task as a nephrologist?
Thank you, Nick. So I think it's always confusing. Nephrologist is a kidney doctor. Urologist is a kidney doctor as well. But urologists, they are the surgeon. They are the one who cut things up, look after your prostate, remove your kidney. While as a nephrologist like me, we do see patients. So usually we deal with patient who needs dialysis. So that's our bulk of the job that we see. But we also deal with somebody who has SLE, who has affected their kidney, those who have blood in the urine, protein in the urine, and so on and so forth. So that's generally what nephrology do.
Mhm. Okay. Before we proceed with our discussion, be sure to stay tuned until the end of the webinar because we will be having a giveaway for 6 lucky winners with the most accurate answer to stand a chance to win, carrying cash voucher worth 50 ringgit each. So, 5 ringgit, 50 ringgit bukan 5 ringgit. 50 ringgit tu tak jawab rugi tu. So, our topic for today is post-Raya edition. Watch out for diabetes and kidney diseases. So, let's dive right in. Doctor, can you explain what diabetes is and how prevalent it is in Malaysia?
Yes, I think most of our audience would know what is diabetes, but if I could recap, diabetes is a condition when our blood sugar in our system is high, and that's because our body could not process the sugar. And that can be either because, so when we eat, there's a lot of sugar coming into our body. So our body detect it, and then they start secreting insulin. So our body start producing insulin to counter the high sugar. So in somebody with diabetes, actually, it's either because their insulin is not enough to counter that high blood sugar after eating, or basically they have a good amount of insulin, but somehow the body could not recognize it. So yes, so diabetes is a condition when our blood sugar is high in our body. As regard to the prevalent is how many patients or how many people actually has diabetes in certain places. So in Malaysia, so if we could go to the slides, so in Malaysia, we actually have what we call a survey every 5 years or so. And the last survey was in 2019. This is when they do go house to house, collecting thousands of data, checking people's sugar and blood pressure. And from there, they know in 2019, our prevalence of diabetes is about 18%. So that's roughly about 1 in 5, like what the videos were showing initially. So the hypertension is about 1 in 3, while the CKD or kidney disease is about 1 in 7. So again, diabetes is about 18% of patient, 18% of people in Malaysia has diabetes. But if you look at a different ethnicity and different ages, you can see a lot more kind of a detailed data. So you can see in ethnicity, people of Indian origin has a higher chance to get diabetes somehow. And from the age point of view, you can see the older you are, the more likely that you have diabetes. For example, if you are 60 years, 40% of people would have diabetes. So really, we need to be aware of this. Back to you, Nick.
But I think one thing that I don't expect is that there is actually quite a lot of people who are having kidney diseases. We don't expect that the number of people having kidney disease is actually close to those people who are having diabetes. We thought that kidney problem is quite an isolated problem, but when we are looking at the graph just now, only then we know actually a lot of people are having kidney disease. So now that we know what diabetes is, what is the cause for diabetes, and who among us is possibly at risk?
So there are two questions there, Nick. Who among us can get
who among us,
diabetes?
can get or have a
And
higher
then another
risk?
one is, the first one is
The cause of diabetes. What
the
are the
cause
main
of diabetes. Yeah, the cause of diabetes is a bit peculiar, because we all know there's a type 1 diabetes and type 2 diabetes, and type 1 usually affecting more of a younger generation, children, teens, while type 2 diabetes affecting more of an adult population. Although nowadays there are a lot more type 2 diabetes children nowadays compared to what it was previously. So yeah, type 1, the causes is autoimmune. Somehow the immune system just attack your pancreas, which produce the insulin, and then your insulin cannot be produced. Hence, that's why type 1 diabetes, they need insulin to replace the pancreas that cannot produce insulin. While type 2 diabetes is more of a, associated with obesity. The body cannot regulate the insulin, although they do have insulin. So those who are at risk of diabetes. So let's bring up the slide. So there are many. So technically, if people have any medical problem that is associated with heart problem or diabetes, for example, if you have family history of diabetes, if you are overweight with hypertension, with kidney problem, women who during their pregnancy has a condition called gestational diabetes, meaning their blood sugar is high during during pregnancy only, and these people, they are really at high risk of getting diabetes. I remember when I was learning, not sure whether is the statistic is true or is getting worse. Women who have gestational diabetes, the risk of them getting diabetes is like 50% in 5 years. So that's pretty significant.
Okay. But regarding all this kind of diabetes, I think a lot of patients that we see, most of them, they don't really know about type 1 diabetes. So I think it's good for doctor to mentioning about diabetes as actually type 1 and type 2, what is the cause, and then what is the common age group that is kind of associated with it. So now that we know what are the causes for diabetes, what are the risk factors for diabetes, so doctor, what are the common diabetic symptoms? Because a lot of people, they are worried, might I be having diabetes? But at the same time, they don't know whether they have it because they don't feel anything yet. I think the video during the starting time, I think it's the same thing. A lot of people, they don't feel anything. So that is one of the main problems with diabetes. So if they were to feel any symptoms, what kind of symptoms, so are we going to expect?
Thank you, Nick. Common question. So what do you think? You remember when you're learning before this?
Yeah, it's a bit what you call it? It's a bit technical term polyphagia, polyuria, polydipsia.
So
yeah. So
you're right. So poly means plenty.
For our
poly means plenty. People who have a frank diabetes, frank means they really have diabetes. Usually they would have a thirst because they are losing a lot of fluid, because in their body they have a lot of blood sugar. When you have high blood sugar, you tend to get rid of those sugar in your urine. So that makes you pee, or that makes you pass urine, a lot of urine every day. And that makes you thirsty, and hence you need to drink more. So polyuria means you pass a lot of urine, and polydipsia meaning you have to drink plenty. Those are the signs that you may have, or symptoms that you may have diabetes. Losing weight may be a sign that you have type 1 diabetes for children, and gaining weight and obesity may be associated with diabetes of type 2 diabetes. If we can put up the slides. So if I mention diabetes, we also have other things like hypertension, high cholesterol, kidney disease. And of course, if you look at the internet, you Google it, they always come up with symptoms. Like, you know, if you have high blood pressure, ada pening kepala, sakit kepala lah, headache, neck pain. Only then you think that you have diabetes. And kidney disease, people think that when you have confusion, vomiting, flank pain, only then that means you have kidney disease. But what we have learned from the video, Nick, that all these actually, there are a lot of patients who does not know that they have all these problems, diabetes. So the survey that I was mentioning to you in 2019, more than 50% of patients actually does not know that they have a diabetes. More than 70% of patients, they don't know that they have a kidney disease. So imagine that. So even though we can rely on these symptoms, but still, those who are at a high risk, they have a family history of kidney problem, they have a family history of diabetes, they should go to the doctor and check their blood. So yes, so that's my message.
Yeah. So now that we know what are symptoms, if they were to feel any, what are the complications? I think it's same as the video that is mentioned. A lot of people only know about amputation. Gula tinggi potong kaki, gula tinggi potong kaki, right? This is what they know, but there's actually a lot of different complications for diabetes. So, doctor, can you let us know what are the other complications involved?
Yeah, you're right. Potong kaki is one of the major complications of diabetes, and I think the reason why patients are looking at the potong kaki more often because that's what visible. Having an eye problem like the patient, the video was saying, people cannot see. Potong kaki, immediately people know that that's because of something. So that's how visually distracting diabetes is. I know that if I put up the slides, there are a lot of complications of diabetes. And people sometimes can be, overwhelmed with a lot of complication, and there's no denying that it is. So the slides will show you that there are four common complications of diabetes that I think everybody should know. Number one is a heart problem. Okay. Number two is a kidney problem. Those are common as well. Number three is an eye problem. And number four is a leg problem. So all these four are the most common complication of diabetes. Now, if you want to expand that, the diabetes can affect, because diabetes can affect your blood vessels, and blood vessels are everywhere. So you can have a stroke, you can have a, blood supply to the legs are not enough, blood supply to the eyes not enough, blood supply to the kidney is not enough, and all sorts of things. But again, the four main complications are the kidneys, the heart, the eyes, and the legs.
Okay, so before moving on, I would like to stop Doctor for a while, because this will be the time for the first round of giveaway for the 50 ringgit cash voucher. So this is the giveaway. The question is kidney damage one of the diabetes related complications? Yes or no? It's quite a simple question. Let me repeat. Is kidney damage one of the diabetes related complications? Yes or no? Okay, comment your answer in the comment section, and 3 lucky audiences will be selected after the live stream session to win Caring Cash Voucher worth 50 ringgit each. Do remember to like Caring Pharmacy Facebook page, like and share this live stream, and tag 3 friends or family together with your answer in the comment section to increase your chances of winning. So with the advertisement aside, so let's continue, Doctor. So for diabetic or hypertensive patients, as you have mentioned, they are the one at a high risk of getting kidney problems. So what do they need to do in order to watch out for kidney disease?
Okay. Were you giving answer just now to the question, Nick?
Oh, was I? Oh, I hope they did not hear anything.
No, you mentioned your question now is the answer of the previous question.
It's okay.
But anyway, question again, sorry, I missed that.
Okay, the question is, for those who are diabetic or hypertension, or no, we have that hypertension, we know that these are the risk factor for for the kidney disease. So knowing that, so what can they do if they have diabetes, they have hypertension? What can they do to watch out for kidney disease?
All right. Okay. Thank you, Nick. So kidney disease is a sensitive issue because I think based on our experience, every time patient do the blood test and they notice that it says they're stage 3 or stage 4 chronic kidney disease, immediately they thought about dialysis. Okay, not necessarily. So if I could say that like I said just now, kidney disease is one of the main complication of diabetes and hypertension, and it takes a while actually for diabetes to cause all this complication. So sometimes it takes years for the complication to happen. The problem is those who were diagnosed with diabetes type 2, let's say at 30 years old or 40 years old, they realize that they have diabetes because of medical checkup. Now, most of these patients, they actually have diabetes for a number of years already without them knowing. So the complication may have happened by the time they know it already. So that's one of the problem that we have. If you can put up the slides. So one of the way to know that somebody has a kidney problem, there are three things. This can be done easily at a GP or at certain other places. So number one is you do the blood test. Number two, you do your urine test. And of course, the third one is optional. Not necessarily you need to do it, but imaging test. So imaging in the sense of doing ultrasound to see whether your kidney has stone, if you have any cysts or things like that. Most of the time, the imaging would not pick up many things, but it's one of the completion factor. But the two main things is a blood test and the urine test. Blood test, I think most people, if you are familiar with blood test, you have all sorts of tests, right? One of the things that you want to look at is the creatinine level, which they will usually show EGFR or estimated glomerular filtration rate. So yes, those are the things that you can see, and if you do the blood test, they will kind of show. I know this is technical a little bit, but if your EGFR is less than 60, that means it's as if that your kidney is working less than 60%. And that is when we say you do have kidney problem. As to the urine test, okay, generally, even if your kidney function is normal, if you do a urine test and it shows up that you have protein or you have blood, that means you may have kidney problem as well. So it's not enough to check the blood only. You need to check the urine as well, especially for diabetes. Most of the time in the early phase, the blood test may be completely normal, but then they may have a little bit of a protein itself. And the way to do this protein check, you can go to the GP, check the protein, and sometimes it shows you have a bit of protein. I think in this session, we do have a test where it's very sensitive, whereby even if your usual dipstick that you do at GP did not show any protein, but this very sensitive protein test, if it's positive, that means you are at a higher risk to develop kidney problem, heart problem, and so on and so forth.
I think it's a good point from Doctor mentioning about this protein test, or in this case we call it a micro test. I think this test, I think from what Doctor mentioned, I think it's a good thing. We know that it is a very sensitive, it is a very good early detection for any sort of these kidney problems. So with us knowing the problems or the damages of diabetes, and then also the kidney problems, so what kind of treatment is available if, let's say, for those diabetics with kidney problems? What kind of options are available for them?
Okay, thank you, Nick. I think I know that as a physician, usually people expect when we speak about treatment straight away we go to the medicine. So not necessarily. I mean, almost every disease that we have, we always have a non-pharmacological treatment or non-medical treatment, especially when the stage is still in the early phase. You just been diagnosed with diabetes. You want to try whether you can reverse this or not, especially, you have not been looking after your diet properly, you have not been looking after your exercise and watch out your weight properly. So in the initial period, yes, you may do things that may save your diabetes or your blood sugar, or lower down your blood sugar without taking any medicine. But this need to be overlooked, but to be looked after by doctors, because you can imagine, of course, as a patient, even for myself, if I am diagnosed with diabetes, then you want to try all this exercise, but if you don't go for follow-up with the doctors, then you think that you have successfully managed your diabetes because you exercise, but you may not be. So always do it under supervision with a doctor so that you know that what you're doing is working. So if you can go to the slides, the summary slides that I have. So the pyramid, okay, so starting from below to the top. So below means that everybody with a new diagnosis of diabetes, they should try these, okay? Exercise, stop smoking, looking after your diet, and then make sure that your blood pressure under control, because most patient who has diabetes, they do have blood pressure problem as well. Make sure your sugar is under control. Know how to check your blood sugar. Go to the pharmacy, Caring Pharmacy, because they can check the blood sugar. Is it for free, Nick?
No, it's not for free. It's not for free.
Okay, so
it's
lipid
very,
control.
very affordable.
Yeah, so because some people do afraid to check their blood sugar. So yeah, easily. We always say to the patient, go and check your blood pressure with the pharmacy. If you have a machine, every once in a while, counter check with the pharmacist, because their blood pressure is at least calibrated, and then just make sure that you calibrate your blood pressure with the pharmacist.
So I think it's good for them to have the machine, or if you don't have machine, it's fine. You can always come to the pharmacy for us to check. Especially for those who always say, saya ada machine tapi saya takut lah, kena cucuk, saya takut, saya datang, saya ada machine. Boleh, tak ada masalah. You can always come to Caring Pharmacy, and then we can check for you.
True, yeah. It's I think one of the, you give power actually when you ask the patient, or when the patient has the ability to control or to know how they are doing, like checking blood sugar and checking blood pressure. You really give them control or sense of control that, I can do this, I can control my blood pressure. And even as a doctor, when patient comes with all the list of blood pressure they have done, it's a happy thing, because they really look after themselves.
Yes, because at least they can see the improvement. When they see the improvement, then it will improve their compliance on their medication. If they don't monitor, they will just take the medication and then they don't go and see the doctor. Because to them, saya dah ada makan ubat, I will ask, dah control ke tak? Control ke tak? Saya ada makan ubat. Sometimes to them, taking medication means curing the disease, right? Take medication, problem settled. So when you have a proper monitoring, I think it's very important, so that they can see the progress. It is not end of the story. I have ubat. It's not end of the story. I still have to follow up with the doctor. So I think this is very important. It's good for doctor to be emphasizing this here as well.
And also, Nick, if you talk about what to do if you're not planning to take medicine yet, of course under supervision of doctor, there are, I think, 3-4 things that you can do that definitely can help your diabetes and the high blood pressure. Looking after your diet, looking after your exercise, losing weight, those 3, and stop smoking. So these 4 certainly will help anybody who has diabetes and high blood pressure. So if you can go to the slides, weight loss, over 10%. So they say 1 kilogram of weight loss will reduce your blood pressure about 1 millimeter mercury. So that's pretty significant, especially if you lose up 5 kilos or something like that. For diabetes, make sure it's not just sugar. All the carbohydrate will be changed into sugar. So choose your carbohydrate nicely. Some people believe that if you take more of a whole grain diet, brown rice, whole meat bread, that may be better for diabetes. So yeah, so some people do say that. From the blood pressure point of view, what is it? Not sugar, salt. Yes, salt intake is very important, because in the salt there's a sodium in there. Some people replace the sodium with the potassium salt, and from the blood pressure point of view, that is actually good, potassium salt. But from the kidney point of view, that may be a bit more risky. For those who like to exercise, now I think everybody do marathon. I think 2 years ago, before PKP, Kanik, everybody do marathon, or everybody do running. So it's like everybody do running. And there's one time everybody do cycling. Do you, Nick, cycling?
I'm not a very active person. So if you ask me, I'm the one who has a high risk of getting hypertension, diabetes, all
You
this
look fit enough, Nick. You look fit enough.
now at now, but we are not. But if you're talking about 10 years, 20 years, that could be a problem.
Really? Okay.
So
Exercise, yes. Exercise sometimes you don't have to think about I have to run marathon, I have to run jogging or whatever it is. Because what we need, of course, the recommendation is doing it regularly. If you can do 30 minutes a day, 5 times a week, that would be good. But I think we may have some problem for most of us to do 30 minutes of exercise if we don't spend or if we don't dedicate the time to that. So this is a separation. If you plan to do like cycling, gardening, fast walking, dancing, you need more time in a week. But if you try running and jogging and cycling uphill and those things, then you may need only like half of the time of exercise every week. I know that it's easy to say. I probably did not reach that amount of exercise, but this is our aim. This is what we want to do: exercise and look after our diet.
I think I always feel bad as well. I always tell my patients, hey, you need to exercise, you need to cut down your sugar. But then the next thing I do, I hit the mama. So yeah,
It's
but
okay. I mean, you can choose the food in Mama as well. Instead of roti chana, you can choose what is it?
tosse,
Tosse, yeah,
tosse,
because it's
yeah, which is the
less
healthy
in calories
option.
as well.
Mm-hmm. So I think we want to talk about a little bit on the medication just now. I think in the slide, can we have the slide
Yeah. Okay.
on the I think the first one. I think during the first one you were talking about I think you mentioned about something like SGLT2. That one is something like a newer sort of medication. Um, I think it is good for us to emphasize a bit that there is a revision in terms of how we so how we're recommending our patients to take their medication. So I think for those who haven't been seeing a doctor for a very long time, like in 5 years time or 3 years time, I think it's good for you to see your doctor because there are some new medications in the market. So the medication that you have might be might not be the best for you. So it is very important for us to not go and see a doctor once and then just take the medication for 3 to 5 years time. I think it's very important for us to see the doctor every day because not every day, but regularly, because the medications, there are always newer medications coming up, and then your body is not the same condition every year, and then everyone's body changes over year. The medication might be good enough for you now, but it might not be enough, or it might not be good for you, not good enough for you 3 years or 5 years down the road.
Okay. Yeah,
So
agree,
yeah.
agree, agree with you, Nick. Because we see a lot of patients as well. Like you say, they were given medicine for the patient, and then they were given medicine for diabetes or high blood pressure, and then just continue the medicine as if that by taking the medicine, that's it. Yeah, my blood pressure is cured or my blood pressure is under control, diabetes under control. Not necessarily. There are patients who needs one medicine only for diabetes, but somehow there are patients who need 3 medicine for diabetes. The most important thing is the blood sugar has to be under control. In the slides I have now, I think it depends on how technical we want to get. Basically, there are many medicine for diabetes, and for those with the kidney problem, we have 2 particularly very important. So almost everybody with kidney problem and they have diabetes, the initial, depending on their kidney function, they should be on metformin and they should be on SGLT2 inhibitor. The one that you mentioned, SGLT2 inhibitor, that's the main that's a new medicine that has been shown to reduce kidney problem by 40%. We cannot reverse the kidney problem, but at least we know we can slow down the progression. So certainly go back to your doctor because this medicine is only, I think, available for the past 2 years. So it is coming. People are getting familiar with it. So just know the side effect or potential side effect and discuss with the doctors of what's the potential medicine that we can get for those who are needing medicine.
I think Doctor made a good point that kidney is sometimes a one-way road. So it is very important for them to go and check with a doctor regularly, because the longer you drag, the more damage it can the sugar can damage your kidney, and sometimes it's really, really hard, if not impossible, for you to reverse back to what it was 10 years ago. Yeah. Okay. So
what is it? Go on.
Can you hear me, doctor? Can you hear me?
Yeah, I can hear you.
Can
So
I?
yeah, you're right. As in, unfortunately, once the kidney is damaged chronically, so the important thing is damaged for a long time, generally we doctors would say it's unlikely for the kidney to get better again. There may be a slightly fluctuation of the kidney function, but if your kidney is already, let's say, 20% for a long time, chronic, not just happened just now, 20% for a long time, it is unlikely for the 20% to become 60%. Yes. So yeah, so
But
that's
it's
the important
also
thing.
yeah, that's why it's also very dangerous for them. Because a lot of people they go to and see a doctor. The doctor will give them medication, and they will come to us say, "Oh, saya tak nak ambil ubat lah. Sebab ubat ni tak baik untuk buah pinggang. Ubat ni tak baik untuk badan. Kalau lepas saya dah start ubat, saya kena continue makan sampai saya mati." So this kind of thing is what we hear every day. And some of the time they will say, "I want to try this thing. I want to try that thing. I want to try with this daun, that daun, this pokok, that pokok." So what is your opinion on this? Is it possible for them to stop their medication first and then go on something else and then come back? Is it the right thing to do?
Okay, if you allow me to kind of explain a little bit, if I could use the slides. It is true, there are a lot of patients who are afraid that when they take medicine, it can destroy the kidney. And not only layman or not only layperson, even doctors sometimes think that certain medicine or most medicine may destroy the kidney because the kidney has to work extra hard or something like that. Now, if I could give a comparison, because I usually tell my patient, or I explain my patient a little bit. If you compare a newly diabetes patient who has high blood sugar, we have Pak Ali and Pak Atan. So both have a newly diagnosed diabetes. Pak Ali was given medicine to control the blood sugar. Pak Atan did not take anything and let just the sugar loose. Okay. So the idea is, if the condition or if the kidney problem is because of a medicine, then we would expect which one will get the kidney first? Of course, Pak Ali, because he was given the medicine. But in actual life, what really happened in life, Pak Atan, who did not take the medicine and allow the kidney function or allow the diabetes to be not controlled, these are the patients that will develop complication first. Hence, I would say, or I would argue, that the complication, the kidney problem, the eye problem that patient have, mainly it is because of the disease itself and not necessarily because of a medication. This is as if somebody who are very well, bila pension, they just go to the hospital and then they will diagnose with all sorts of things, diabetes, hypertension, whatever. And then they say, oh, it's because I go to the hospital, that's why I have diabetes and hypertension. Why we know that's not quite true, because the patient may have it for quite some time.
Yeah, I think medication is always a risk and benefit. They will ask me, would this medication damage my kidney? I said, likely not. But if you don't take it, you are very likely to get kidney problem. So if you don't take it, I think the point is risk and benefit. If you don't take it, you will be highly likely to be getting it. So this is what I always emphasize to my patients. Always weighing risk and benefit, is always choosing between two. So it will be quite clear here when it comes to diabetic medication, you take it. It can help you to control your sugar. It can help you to control your kidney problems. If you don't take it, then definitely within 5 years or 10 years, your condition will be sliding down very quick.
Follow up, Nick. I mean, nowadays, although we say once you are on medicine for diabetes, you may be on it for lifelong. But there are patients who basically, has diabetes, were given medication, and then they look after their diet, lose weight, controlling their diet, salt diet, sugar diet, and then exercise as well. Some of them do manage to bring down the blood sugar to the extent that they may not need medication anymore. So, but then, you cannot do this on your own. You really have to have doctors who can look after or check your blood sugar, check your HbA1c properly, so that they know that what you're doing is right and continue what you're doing is right.
I think we have quite some slides with us. I think with us regarding the myths, right?
Sure.
We also like to address certain myths, on the diabetics, whether this thing works or whether that thing works. I think Misai Kuching is one of them. Misai Kuching. I think a lot of patients will tell me, Tak apalah, Ubah tak payah makan dulu lah. Saya nak cuba misai kucing dulu. So, what would be your response to this,
Of course,
doctor?
I try to be fair. So I try not to shut down this medicine, but also cannot encourage people to take this because there's not much evidence behind it. So what we know now, I think I got this from the MOH website. So these are the what they call not potential. These are the medication that may have been shown in a lab study or an animal study that may help in reducing blood sugar, right? However, you have to be aware that in a pharmaceutical kind of industry, it will take years. If I could show you, yeah. So it will take years for development of a certain medicine, and out of one, when you found, let's say you found SGLT2 inhibitor as a very good diabetes medicine, there are like hundreds of other potential medicine that did not see the light of end of the tunnel because of many problems. You know, they start with something and then they have a extra toxicity. They start with something but it's not beneficial enough. They start with something, so we have to undergo all these trials in order for us to say yes, that's beneficial. Hence, I would say that this medicine are potential because these medicine are not available in other countries. So it is up to us, doctors and pharmacists and pharmacologists and researchers, to put this into practice. As in, maybe one of them may be beneficial in many years to come. That has been shown, but at this particular moment, we cannot really encourage people to take this because we don't know. Number one is that we don't know whether it's effective or not, and number two, even if potentially they may be effective, we don't know what's the side effect of this because we know that everything has their potential side effect. If I could draw your attention, Nick, examples of traditional medicine has become modern medicine, right? So previously people use it as a traditional medicine, but now people use it in the modern clinical medicine. For example, most of anti-cancer medicine, they originate from plants. And you can read there. I don't know how to pronounce it. Catharanthus resius.
Yeah.
But now
You
it
just
has
call it
become
vincristine.
Yeah, vincristine is a very common anti-cancer drugs. Okay, but you have to undergo research in order for you to reach at this conclusion. Even the SGLT2 inhibitor that you mentioned just now, originally is coming from the bark of an apple tree. Okay, so the European people, they were probably taking bark of apple tree, mix it, whatever it is. But we know if you take the bark of apple tree now and eat it, you probably have a lot of diarrhea because the inside there are properties of SGLT2, but there also SGLT1 in there, and that can cause diarrhea. So you see, we need this research so that we know what are the side effects. We can change the molecule a little bit and then make it safer so that people can benefit from it. So I'm not saying that all this traditional medicine certainly has no values at all, because in the future they may have, but we need the research. We really need the research to know whether it's working or not, it's beneficial or not. So for the time being, I really cannot recommend those just because we don't have enough evidence for this traditional medicine.
Mm-hmm. I think sometimes for me as pharmacist, I'm also keeping it open. I will give them the option, but to stop your medication over, like a misai kucing tea. You want to take misai kucing tea, to me it's okay, but to stop your medication and then just chuck it aside, I think that would be a bit too much, because definitely you don't expect a misai kucing tea to be, let's say, having the same medication as, let's say, metformin, SGLT2. That one would be definitely out of the question.
Because
before,
because they probably think that misai kucing probably not much of a side effect medicine when they have blisters and things like that, more associated with more side effect. But yeah, we don't know, to be honest.
Yeah.
I also tell patient, Nick, I also kind of a democratic. I don't tell patient do not take it, but I tell them that I don't have evidence. But if you take it, you probably have to buy it. At the end of the day, you probably lose money as long as it doesn't cause more harm, which I don't know whether it will cause more harm or not. So yeah, so at the end of the day, simple answer from me, I really don't know, but it's a risk that you have to be willing to take.
Yeah, because sometimes I also leave it to you, but I will because sometimes for a pharmacist or doctor to tell them right off not to take it, they will likely they will just don't listen to you, right? But
Mm.
when we leave it open to them, at least we discuss with them, then they will at least oh, okay, we can discuss, we can discuss. So at least, oh, I will take this together with medication. At least it's not that bad. At least as compared to they outright stop the medication. Yeah. So I think that's a very good response from the doctor, so that we know where all of this herbal treatment stands as compared to the medication. Before we move on to the question, I think we have quite a lot of questions with us. Before we move on to the Q&A session, I think it is time for us to talk about the micro test. Because I think doctor talked about the micro test just now, right? The early detection, detecting the protein in the urine. So I want to talk a little bit about the test because you can actually get a free micro test. So maybe I'll just quickly go through how you can get a free micro test. Can someone put up the slides? Yeah. So you can actually go to this www.beyondsugar.my. There will be a chatbot that will be able to advise you. Yeah, this chatbot is very canggih one. Okay, so you just press, see chatbot there, right? You can just press the chatbot, and then they will ask you, regarding the risk factor, whether you have, heart problem, whether you have kidney problem. Then you can just pick one option after another. Then they will lead you and let you know whether you need a micro test, and then where you can get a micro test. Maybe next slide, please. Yeah, this is a chatbot. Yeah, they will ask you one by one. Next.
Oh, they ask you what can you do? Okay, this is
Yeah,
like all
yeah.
the
What
other
can you do?
chatbots.
Yeah,
Okay.
it's quite so you got Changi. You see here. Just now I was actually I tried. You can actually go in, whether you have diabetes, and then whether you have hypertension, your cholesterol. You can just put it, and then they will actually calculate the risk for you. So
Okay.
if the bot, the chatbot determine that you are actually high at risk, after you key in they will ask you for your kidney function. They will ask you for your blood pressure. They will ask you for your cholesterol. So whether you have cholesterol problems. After you key in everything, they will let you know whether you are at high risk. And then if you are determined to be high risk, they will ask you a postcode. Once you key in the postcode, no, the bot won't come and visit you at your house. So don't worry, you can just key in the postcode will do. The postcode is actually for them to search for the clinics that are nearby your house, that is offering the micro test. So it's actually a free micro test. So don't worry, we will not go to your house. Just key in the postcode, and then they will advise you on which clinic that you can go.
Does this apply to whole Malaysia or something like that, Nick? Do you know?
I don't think it's
Or
whole.
really depends.
It's a bit hard to reach certain parts of the country. If you're talking about in those very rural areas, then I think that would be a bit tough. But it's okay. You can just key in. They will let you know what the
Oh,
nearest
so
it
for
will be.
example, you have that three nearest clinic that run free
Yeah, correct.
neuro test.
Yeah, I key in my postcode. They will let me know which one that I can go.
The
Yeah.
audience need to know this is a special kind of dipstick to check the protein, not just the ordinary protein that you buy from the
Yes.
pharmacy. This is like micro, a very minute protein even they can detect, and that's a risk factor for you to get heart disease. So by having it,
Yeah.
there will be there will be it.
There are actually 700 clinics nationwide, so it's quite
Wow.
widely available. So don't have to worry that you have to drive all the way from Pahang until KL. No, 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 you don't have to do that.
Seven
Yeah,
hundred is a
700.
lot. So that means if you divide by 14, berapa
I'm bad at
eh?
maths.
60 clinics every stage roughly. So that's
Yeah.
plenty. Okay.
So this will be the QR code. You can just scan, and then they will bring you right to the Beyond Sugar website lah.
Okay. What's the name of the website again, Nick?
Beyond Sugar.
Beyond Sugar, Okay.
Yeah, www.beyondsugar.my. I think we were talking about the albumin, right? And so for those who are a bit confused on albumin protein, albumin is basically one type of the protein, but it's a protein that is the most common found in the urine. So it is actually more sensitive as compared to the normal protein, the protein test. So it will be a very good and very sensitive test for those people who are diabetic, or if you have concern of kidney problems. So it's good for you to get a check so that you can get a peace of mind. Okay, so now with that done, we will be talking about the next giveaway, the second round of giveaway. I've just mentioned it like 30 seconds ago. The question is, which website mentioned provides a free micro test? Okay, which website mentioned provides a free micro test? Is it A, www.abovesugar.my, B, www.beyondsugar.my, or C, www.belowsugar.my? So, same thing, comment your answer in the comment section. 3 of lucky winners will be getting the Caring cash voucher worth 50 ringgit. So do remember to like Caring Pharmacy, like and share the live stream. And if you want to increase your chance of winning, tag 3 of your friends or family. Okay, now we will be moving on with the Q&A session. We have a lot of questions with us, Doctor. I think they are really, really passionate about this topic today. I think because a lot of people, they have sugar concerns. A huge chunk of Malaysians are actually diabetic, and they are actually always worried about risk of amputation, risk of kidney. So I think that's why they are so passionate today. So I think, okay, the first question, is stress also trigger diabetic? Is stress a trigger of diabetes?
Not that I know of directly, but if you think about it, if you stress and you like to overcome your stress by eating cakes and desserts, and so those behavior may have contributed to the diabetes itself. Now, as regard to the blood pressure, however, we know that when you're stressed, your blood vessels are all kind of a constrict, flight and fight response. So in that particular situation, you may have a high blood pressure. And you can imagine if you have a stress over a long period of time, then your blood pressure may be elevated for a long period of time. That may not be good for you.
Yeah, I think not only on eating, when I'm stressed, I have to drink a cup of sugary drink, be it coffee, be it Coke.
Maybe some people are stressed and they run. Maybe that's a better idea.
Is there anyone like that? I think most of them, they will.
I know somebody like that though. I know somebody like that. Not me, unfortunately.
Okay. Then I think that is the rare. I think more people will be like me lah. Coffee first. We can think about it later. I'm serious. Coffee first. So yeah. So the next question, doctor, can you please explain the connection between diabetics and kidney diseases? Why diabetics leads to kidney diseases? I think for a lot of them, they find it like two completely different concept. Diabetics is sugar. Why does the sugar can make your kidney damage?
Okay, so I think there are people are still kind of researching about this. I think there are two pathway that I can explain to you. Number one is like the blood vessels. Okay, so when you have a high blood sugar in the blood vessels itself, so everywhere the blood vessels that has been exposed to blood sugar will undergone some changes to accommodate that high blood sugar. And that changes of the blood vessels basically is harmful to the blood vessels. And when the blood vessels are constricted, the blood flow cannot go through easily. So that's when you have damage, reduction of blood supply to the kidney, to the brain, to the heart, and all sorts of things. So that's one of the mechanism. And number two is that I think as a nephrologist, when we do a kidney biopsy, meaning taking a sample of a kidney in somebody with diabetes, what we see basically the nephron or the functioning unit of a kidney is just become sclerosed, meaning the whole thing is not functioning, and we suspect that's again because of the reaction to the high blood sugar that the patient has. So it is a reaction or inflammation to having a high blood sugar in our body.
Mm-hmm.
And not only kidney, it's other organs as well.
Mm-hmm. I think this is a question that doctor has mentioned, but I think it's good for doctor to explain again on this. From Selena Liu, taking too much medicine and supplements is also taxing on the kidneys. What is Prof's opinion?
I would say I will start from the beginning. Why do you want to take those medicine? Or why do you want to take those supplements? Because I'm sure you're aware of different discussions happening. With the fruits and vegetables that we take, generally speaking, that should be enough for our supplements of vitamins and minerals. So we technically do not need to take extra vitamins or supplements unless we having certain condition that requires us to take all those things. So so number one, we go to the back, the original question, why do we need to take that? And if you need to take those, then technically I think we have to kind of think a little bit of which supplements may be safer then which supplements, which other supplements. For example, if you go to the pharmacy and take multivitamins, and I think with the KKM logo and everything, multivitamins that contains in all the food that we take, so less likely for it to cause much of a problem. But if you go and take certain traditional herbal medicine that's not usually something from the food, then that may be a bit more risky. Yeah. So I myself, I try to avoid those.
When it comes to supplements, I think don't just get it from online or any sort of make sure it is approved by KKM. Make sure that it is through a valid channel and not those that you can just buy on, let's say, any sort of online
Have you
portal.
heard, Nick? I think
Facebook. There's a lot of Facebook.
True. Have you heard, Nick? I mean, most of the not most. I mean, certain those who are not was sold online or whatever it is, in order for it to be effective, so they know that certain medicine is effective. For example, the painkiller, the NSAIDs, the Voltaren, or whatever, so those things are effective, and steroids are effective for many conditions. So they just lump everything together, put into the pill, and call the pill something else, and then that's when it becomes dangerous.
I think steroid would be one of the common things, because steroid is something that is a very strong medication. Sometimes it can have some side effect, but if you're having some pain or whatnot, when you take it in, the effect is going to be very, very effective. Be it sore throat, be it pain, any sort of inflammation. When they take it, they will see instant result, right? So to them, they are taking something that is natural, without side effect, and at the same time effective. But little did they know, actually they're actually taking some very strong medication that you should not be taking under the supervision, or unless it's prescribed by a doctor. I think that would be the main thing. There are a lot of like the so-called traditional medication that they actually inside they put in the steroids. So yeah, so make sure that if you want to take it, it's through a proper channel. Maybe let us go to the next question. How to reduce the side effect and dependency on the diabetes medication? I think a lot of patients are still having the same thing, right? The dependency, side effect. I think these again are the things that they are very taxing on kidney. These are the things that they are worried. Especially, I think during the slide just now, it is actually mentioned there are a lot of side effects. That's why they're asking this question.
Now, as doctors or as physicians and pharmacists, we basically have to be honest, because we're not like selling online where, oh, please take this medicine, it's very good for you, will obliterate all your diabetes and hypertension. We have to tell patients what are the good things and what are the potential risks. Potential risk does not mean that you will get it. Potential risk means that some people may have it, and then we can change the medicine if that happens. So the idea of taxing on the kidney or taxing on the liver, God created our liver and kidney to overcome many kind of toxins that we eat or production that we eat. So some medicine, certainly we should be able to overcome that.
I want to add on. I think I would again like to emphasize on the things about risk and benefit. I think like as example for me, right, one of the risks would be gastro, stomach issues. I think comparing the side effect of stomach issues as compared to amputation, as compared to kidney problems, compared to heart problems, blindness, I think the risk and benefit is very clear. So for medication to be approved, to be recommended by doctors, it would have definitely be weighed the risk and benefit. There is a reason why the doctor is asking you to take this. It is definitely more likely than not, it is that you need it. The benefit is there, so the risk is worth taking. Yeah. So I think that is all for today. So thank you everyone who have joined this Facebook Live, and thank you Dr. Wan Ahmad Hafiz for sharing your really extensive knowledge on diabetes, on your kidney, and on your job. So as for viewers anticipating the giveaway winner announcement, be sure to keep an eye on Caring's Facebook page, as we will be announcing the winners sometime soon. Once again, thank you for joining us, and see you again in the next live stream. Bye bye.
Thank you. Assalamualaikum.